Anyway, what I want to talk about today are the different phases of care in the office. And, that's basically coming up with a treatment plan. With patients, it's always up to them, obviously, how much they want to benefit from chiropractic care. And everybody really comes into the chiropractor for different reasons. So we want to respect that and find out as early as we can what they might be looking for out of care. But we always start with a very specific history and examination, very detailed. For those of you who are patients here, that first visit is pretty in-depth. But anyway, when we do that, we want to find out 3 questions. The first question is, can we even help you with chiropractic care? Now, obviously, most of the people who come to the office will benefit from chiropractic care. I think everybody would benefit from chiropractic, but if they're coming with a certain condition or symptom that's out of the realm of chiropractic, or maybe it's something like if they're presenting with lower back pain, and it turns out that I suspect that they may have a kidney infection or something like that, obviously we want to refer them back to the proper medical physicians. It doesn't mean that we can't continue to adjust them. For that particular condition, they need to see somebody else. So obviously we don't want to start a course of care on something that we may not be the best choice for, or maybe dangerous if it's left untreated. So that's the first thing. But like I said, 99.9% of the people who come to the office, we can help them with their symptoms. The second question is, what's the diagnosis? We try to come up with a working diagnosis so we know exactly what it is that we're dealing with. And then the third question is, I want to get a feel for what the patient might be looking for out of care. And like I said before, everybody comes to the chiropractor for different reasons, but I want to find out what it is that they expect for me to provide for them, but also what they might be looking for. And it really comes down to 3 different types of patients. You have the ones that we call like one and done. Those are the people who want to come in, or the patients who want to come in, they want just a quick crack and be out the door. And that's fine, and that will get good results, but it's really more symptom-based. It's not going to really do any improvement for the long term. It's usually short-term, results. But maybe it's somebody who just had an acute flare-up, and that's really all they need. But, we respect that, and that's fine. The second patient might be somebody who's looking for maybe more symptomatic relief. So maybe they'll come in and do a series of adjustments for a short period of time to relieve the symptoms, maybe for a longer period of time than the one and done might experience, but they're not really looking for long-term care. The third type of patient is somebody who's really looking to correct their underlying problem. And a lot of times those are the patients who, one, understand the health benefits of chiropractic care, and want to experience that. Or they may be dealing with more of a chronic condition, something that's been nagging them, something that might be really interfering with their normal daily life activities, taking care of the kids or their sports on the weekends, or maybe they're an athlete and they have a nagging injury or a lot of repetitive stress that they know if they continue to do that, or in a work environment that is continuing, repetitive stress that puts a lot of pressure on their bodies. They may realize that a longer course of care might be more beneficial for them. So what are the phases of care then? Well, after we do the history and the examination, we usually have them come back for what's called the report of findings. And the report of findings is really when we come up with a treatment plan. And, what are the standards of care for a field like chiropractic or even physical therapy? The standards of care for most musculoskeletal conditions that they might be, coming into the office for, consist of 2 to 3 times a week for a period of 4 to 6 weeks. Now, those are the standards of care. In a perfect world, that would be great for most patients. But, the phases are broken up into 3 different things. First is relief care. What does that mean? It sounds exactly, it means exactly what it says it is, relief care. You're coming with some symptoms. Our primary goal at that point is to reduce your symptoms. Again, if it's something that's more acute or something that's more chronic, or depending on the nature of the injury, it really might change how long that relief care. But again, we talked about the standards of care. So usually we start somebody, depending on how acute, if they're in a lot of pain it may even be daily for the first few days, but most people who are in a lot of pain, we start with 3 times a week for the first 2 or 3 weeks or so. If they're not in terrible amount of pain, maybe we'll start with like twice a week. But usually it's 2 to 3 times a week for a period of 4 to 6 weeks, depending on the injury. Now we will usually, after the 4 weeks, we do a reevaluation. And at that point, hopefully we can start the second phase of care, which is correction. So their pain may be reduced. But remember, last week we were talking about correcting the subluxation. So the symptoms may be improved. Hopefully after a month they're feeling really good. But we want to continue to do the adjustments to continue to correct the underlying problem, which is the subluxation. At that point, maybe we'll introduce more rehab type exercises, go over more ergonomics, things that are going to help hold the adjustment. In the relief phase of care, it's a little bit more acute care, so maybe more passive modalities. Maybe we're doing a little electrical muscle stim, the cold laser, ultrasound, things like that to reduce and calm down those symptoms. As we get more into the corrective phase of care, like I said, a lot of it's the same. We're continuing to adjust, because as we adjust those subluxations, they're going to start holding longer. A lot of questions I get is, well, how do they hold if you're not doing exercises? Well, first off, we usually do introduce some exercise and may do some exercise in the office. But remember, a subluxation is neurologically based. So the more we adjust it, it may come out a little bit, then we adjust it again, it may come out a little bit, so that's every few days or so we want to get an adjustment in there. But we're stimulating the nervous system in a way that, we're strengthening the nervous system. There's going to be improved control of the muscles, and improved stimulation of positional sense and posture. Those types of things neurologically, that's what's going to hold the adjustment for longer. And in a certain period of time, the adjustment, you're going to have the correction of the subluxation, it's going to hold for longer. So that brings us then to the third phase of care, and that's what we call maintenance. Maintenance is really the easiest phase, but to me, I think it's the most important. So maintenance is, we get to the point after we go through a corrective care, hopefully like a month and a half or so, reduce the number of visits, so they may be coming in 2 to 3 times a week initially. Correction, hopefully we can get to like twice a week, or maybe once or twice a week for maybe 4 or 5 weeks, and get to every other week, and then hopefully once a month. And maintenance is usually once every 4 to 6 weeks. I talked last week that I had a patient who would come in for maintenance. Every time he would either turn his clock back or turn it ahead. That worked for him. How corrective it was, I'm not really sure, but that worked for him, and he was still getting the care he needed. But anyway, maintenance is usually maybe like once every 4 to 6 weeks. I say that's just about, the correction and the maintenance, I think, is the most important part of care. Not that we don't want to reduce your symptoms, because obviously we do, and that's why you come to the office, but correcting it and then maintaining it, that's what's going to keep it in a good position. And also, if you're coming in once every 4 weeks, it never lets it really get fully back to where it was before, or it doesn't mean that you're never going to have pain again. But if the pain starts to return, or you re-injure yourself, it's only a month out. We're already on top of it, and usually it takes a lot less care to get you back on track. So anyway, so those are the phases of care. Everything is really, explained to the patients. It's always up to them, like I said. How much they want to benefit from chiropractic care is always up to them. The phases are, we want to relieve pain, we want to correct the underlying structural problem, we want to maintain it. So anyway, so that's all I have for you tonight.